We often see doctors struggle with the OET speaking subtest before they even open their mouths. It usually happens in those 3 minutes of preparation. Most of you spend that time panic reading every bullet point, trying to memorize symptoms. But the reality we see here is that if you're just reading the card, you're already behind. You're acting like a student waiting for a test when the examiner is actually waiting for a colleague. Today, I'm going to show you how to use those 3 minutes to take command of the room. Here we use a system called the ASE Framework. Today, I'm breaking down the first and most important step, Analyze. This is the foundation of everything we teach. If we don't get this right together, your scripting will feel forced and your execution will sound hesitant. I want to help you bridge that authority gap right from the start. When we look at a role-play card, I'm not just looking for medical facts. We're training you to look for 3 specific things. First, what is the mission? I want you to look past the tasks. Are you here to negotiate a discharge or break bad news? If you don't identify the clinical goal, you can't lead the consultation. Second, what is the conflict? We look for the patient's unspoken concern. If the card says they're insistent or anxious, that's your primary target. While students ignore emotion to finish a list, we teach you to address the emotion to finish the mission. Finally, who do you need to be today? Based on the goal, we decide if you are the educator, the negotiator, or the comforter. We always tell our students to decide this during prep, so your tone of voice is consistent from the very first second. If this feels like a lot to process in 3 minutes, it's usually because you haven't been given the right diagnostic tools yet. We've developed a 60-second Gap Audit. You'll find the link right below this video. It's the same tool we use to see exactly where a doctor might be slipping back into that student trap. Go ahead and find your score now, and then join me in the next video, where we'll show you how to turn this analysis into a high-score script.